Hello, my name is Paula Power and I'm the Director of Midwifery here in St Luke's Hospital in Kilkenny. We are delighted that you have chosen to have your baby here with us. We know that every person and every pregnancy is different, and we strive to support and care for you through your unique journey. We hope this video introduces you to the service that we provide here in St Luke's, and we look forward to meeting with you.
Hello there, my name is Dr. Liz O'Gorman. I'm a local GP and I'm going to talk to you a little bit about what to expect from combined antenatal care within your GP practice. Firstly, congratulations on your pregnancy. This is an exciting time for most, but it is also completely normal to feel nervous and to have lots of questions. Most women will have done a pregnancy test at home after they have missed a period, and once this is positive, tend to contact their local GP surgery to confirm the pregnancy. It's a really good idea to bring a urine sample with you to this appointment, and it is likely that your GP will want to repeat their own test. The first thing your GP will discuss with you is whether you are happy and excited to be pregnant, or whether this represents an unplanned or crisis pregnancy for you. We can help you through this. Once this has been established, we will ask you about the first day of your last menstrual period, so that we can calculate your estimated due date and date your pregnancy. We will then ask about any pregnancy symptoms that you might be experiencing. Your GP will then proceed to do a general health check, including a discussion about any relevant past medical or surgical history that you may have, any regular medications that you are taking, or any relevant family history of illness. We will also advise you in relation to foods to avoid, vitamins to take like folic acid and vitamin D, smoking and alcohol cessation, and we will discuss important vaccines in pregnancy like the flu, COVID and whooping cough vaccines. The flu vaccine is safe at any stage in your pregnancy, and both the COVID booster and whooping cough vaccines are offered after 16 weeks. Your GP will then move on to a physical exam and will likely check your weight, height, blood pressure and urine. They will then discuss the antenatal care choices available to you, which include referral to your local hospital for public or private antenatal care or a home birth. During this first visit, your GP will ask you to sign a form for the Maternity and Infant Care Scheme, which is a free scheme that provides care to pregnant women and their babies. It covers you for 6 visits throughout your pregnancy and an extra 5 visits if you have any chronic conditions. It also entitles you and your baby to the 6-week check postnatally. Throughout these visits, your GP will check in on you and listen to any concerns that you may have. They will also do certain checks on you at every visit, and after approximately 24 weeks will listen to the baby's heartbeat with a device called a Doppler. They will also ensure that you are up to date with your vaccines. You should be given a green maternity folder when you attend the hospital for your booking visit. It is a really good idea to bring this with you to your GP appointments, as your GP can write a note after your visit in it and can also see what your hospital antenatal team have documented.
When you're coming to St Luke's Hospital, you will be coming to the main entrance. You take the entrance 3 access and you can park the car in the car park. This door is open from 7 a.m. in the morning until 9 p.m. at night time. When you enter the hospital, always sanitize your hands and follow the markings on the floor until you get to a circle just prior to the cafe. If you're going to the antenatal clinic, follow straight through following the floor signs. Take a left to the antenatal department, check in with the receptionist and take a seat in the waiting area. Always observe social distancing. Midwife will call you for your appointment to be seen either by the doctor or the midwife. If you need to have bloods taken, you need to follow the signs to the phlebotomy department, which is on the first floor. You take a ticket when you get there and take a seat and wait until you're called. Always observe social distancing. For a fetal assessment scan, you come up to maternity floor, which is the second floor. Once you exit the lift, you take a right and straight ahead there is the fetal assessment unit. Reception area is on your left and receptionist will look after you there. If you're referred to our obstetric assessment unit, maybe from the clinic or by your GP, or for preparation for cesarean section, once you come to the maternity unit, you take a left and the obstetric assessment unit is on your right hand side. If you're coming in labour, if it's during the day, you can come to the main entrance. You can follow the arrows to the circle on the floor. If you're coming in between 9 o'clock at night and 7 o'clock in the morning, you need to come through our emergency entrance, which is through entrance 2. This door is open 24/7. There are wheelchairs available at both entrances. Whichever entrance you come through, you'll be coming to this area. You follow the sign on the floor and the arrows that will bring you to the main part of the hospital and all the wards. Any time that you enter the hospital through any entrance, always sanitize your hands and always observe social distancing throughout the hospital. Once you come to the lift, you come up to the second floor to maternity. When you exit the lift, you turn right and you follow the signs for the labour room. There are 2 admission rooms where we can assess mums to see at what stage of labour that they are in, assess mum's health, assess baby's health, and from there we decide if you're going home, if you're going out to the ward, or if you're being admitted to the labour ward. Good evening, you're very welcome to our labour ward. This is one of 3 rooms. If you're in this particular room, this curtain here will be pulled so nobody necessarily knows who's in any of the other rooms. Armchair is here for mum to sit in early labour if she wishes, or partner can sit in it as labour progresses there also. This particular pump here will be used if your labour needs to be induced, where a drip would be put with a drug in it to bring on your contractions. Just because it's here doesn't necessarily mean it is going to be used. Birth ball is here, so if mum wants to sit in it during labour, we can leave it beside the bed. We can adjust the height of the bed to whatever is comfortable for you there also. Just because the bed is here, it doesn't mean that you have to use it. You can adjust the height of the bed. The back part can go up here to whatever is comfortable for you. The lower part can be adjusted there also, and can actually go down into like a bit of a chair. So for the pushing stage, sometimes it's like mums can use like a squatting position. So just to let you know, the bed can be adjusted for mum's comfort. How we monitor mum's health in labour is to monitor baby's heart rate. Now, if everything is normal throughout the pregnancy, we may just listen into baby's heart rate every 15 minutes. This is what we call innards. Otherwise, we might just use a sonic aid and we can listen in every 15 minutes. We can use it when you're standing also. You don't necessarily have to lie on the bed. However, if we have to monitor baby's heart rate continuously throughout the labour, there's 2 parts to our monitor. Top part will monitor contractions, lower part will monitor baby's heart rate. And these are kept in positions with straps like this. Okay? Other forms of pain relief would be Antenatal. This is piped into our labour wards, ready to go all the time. The mouthpiece here would be attached to it, and all mum has to do is just to hold it. You would be instructed in using it when you're actually in labour also. When you're using it, it makes a noise like this. So if you don't hear any noise, you're not going to be getting anything from it. Other forms of pain relief would be the epidural, probably what most people have heard about. So if you're using the epidural, this machine here will monitor the rate of medication is given at there also. When you have an epidural, you won't be able to get out of bed, but you will be turning every hour from side to side. So sometimes we use this particular ball called peanut ball, which you can rest between your knees just to make that little bit more comfortable there also. Ideally, one midwife will be looking after you in labour. But if we're ever out of the room, there is always a call bell, so don't ever feel that you're on your own. Okay? And labor ward is very, very busy. That means might have it for a very short while. Delivery trolley, basically all that's in the delivery set is sterile bowls, clamps to clamp or scissors to cut the cord. Okay? Otherwise anything else has to be added to it. Now normally for the times that are in it, we do have to get dressed up for the actual birth. So normally we would be using an apron. Also we would have goggles, and we would also be wearing masks throughout the labour also. So when you see us getting dressed up, you know that you're very, very close to meeting your baby at that stage. Normally one midwife would be looking after you in labour. When baby is very close to coming, normally at that stage we would call in a second midwife. So normally the baby has 2 midwives looking after you. If we need any help or assistance, we can call a doctor at any time. Next here is what we call the resuscitator. Ideally, when every baby is born, he or she will be delivered up onto mom's tummy, then with skin-to-skin contact for up to 60 minutes. However, if he or she didn't need any assistance with their breathing or didn't cry as quickly as we'd like them to, we just have this ready. There's feed, light, suction and oxygen. Just when we turn this on, it just checks it out. So basically we have everything ready if it's needed. But ideally every baby will be delivered onto mom's tummy and baby will be weighed before he or she leaves the labour ward. Just the weighing scales here. Lights here if mom needs any stitches after baby is born. We just have to make sure that everything is repaired properly. So these lights will just give us that bit of extra light. Just because the equipment is here doesn't mean it's going to be used. Just to be aware that if it's needed, it is here. So, after the delivery of your baby and yourself will be transferred to the postnatal ward to be looked after by the midwives there.
Your dietary advice during pregnancy can be based on your symptoms. If you are experiencing symptoms of nausea and vomiting, we recommend eating little and often, or every 2 to 3 hours, and also choosing foods which are more nourishing. For For example, opting for full fat foods and adding extra energy to foods where possible. Making sure that you're drinking enough fluids here is really important too. If you are not struggling with nausea and vomiting during your pregnancy, this can be a good time to think about what you're eating. What you eat now will help your baby to grow healthily and give them the best start in life, but also help you feel your best. There are also certain nutrients that we need more of during pregnancy, so it's important to focus on these. Try to at least eat 2 portions of protein a day, for example, meat, fish and eggs. These are important for growth, but these foods can also be rich in iron, which is in demand during pregnancy. Aim to incorporate oily fish, such as mackerel, herring, trout, salmon, twice a week for omega-3s, which are important for the eye and brain development. Include dairy products 3 times a day. If you're opting for dairy alternatives, ensure that calcium has been added. In terms of supplementing, there are 2 needed for pregnancy. 400 micrograms of folic acid is recommended for the prevention of neural tube defects. You may need a higher dose if you have diabetes, a previous neural tube defect, or are obese. 100 micrograms of vitamin D is recommended to help the absorption of calcium, among many other benefits. If you are already taking a pregnancy multivitamin, you can check the amount of vitamin D and folic acid, but you should be covered.
Hi, my name is Maria and I work as part of a team of sonographers here in St Luke's Hospital. Patricia, Julian and I work together in the maternity department carrying out scans ranging from early pregnancy to fetal assessment. At St Luke's we offer a midwifery-led specialist clinic dedicated to providing care to women in early pregnancy called the Early Pregnancy Assessment Unit or EPAU. This unit is on the maternity floor, is open 5 days a week, Monday to Friday from 9 until 1. The EPAU assesses women less than 12 weeks with complications in early pregnancy such as abdominal pain or vaginal bleeding. Women are seen in the EPAU by appointment only. These appointments can be made by your GP, by sending a referral, or by the obstetric assessment unit in the hospital, which you can contact by phone. If your bleeding is heavy or your pain is worse, you should attend the GP or your hospital for urgent review. You can simply refer yourself after 6 weeks by phoning into the EPAU office. The EPAU aims to offer women an appointment after 8 weeks if they've had a previous history of 2 miscarriages, or at 6 weeks if they have had a previous ectopic pregnancy. An internal scan is usually required to examine a pregnancy that is less than 7 weeks.
Hello, my name is Sarah and I am the midwife manager in the antenatal clinics. We offer clinics in Kilkenny on Mondays and Fridays, depending on your consultant, and on Wednesdays in Carlow. Once you receive the letter from your GP confirming your pregnancy, a booking appointment will be scheduled for you to come to see us when you are ideally between 14 and 18 weeks pregnant. At this initial visit, you will see a midwife first, who will take a detailed medical, surgical and social history. She will also check your weight, height and BMI. You will be given a pregnancy book of information and leaflets at this visit. At every visit, a urine sample and your blood pressure is checked. You will then be directed to go to phlebotomy, where a nurse will take your bloods. You will be asked to take a seat back in the waiting room until the doctor is ready to call you in. We would advise to allow 2 hours for this first booking appointment.
Hello, my name is Dr. Naveen and I'm an Associate Specialist in Obs and Gynae, working in St Luke's Hospital, where we welcome 16 to 1700 beautiful babies every year. Our experienced and caring staff will be delighted to provide care during your pregnancy and childbirth. After seeing the midwife at your booking visit, you will then see one of the doctors who will perform a dating scan and give you your due date. They will discuss your obstetric history and make a risk assessment, which will determine your antenatal care pathway. A consultant obstetrician will have overall responsibility for your care. You will be advised to make your follow-up appointments, including your anomaly scan, before you leave. It will be a pleasure looking after you during this very special time.
Hello, my name is Dr. Veni. I am one of 5 obstetric consultants here in St. Luke's Hospital who will be responsible for your care during pregnancy and birthing time. At your booking clinic, after your review, if you are normal risk, you will be offered the option of domino or assisted care pathway. Which means this is an obstetric clinic with assisted midwife. If you are high risk, you will be offered a specialized care pathway where you are seen by the consultant and a senior obstetrician. All of this will be discussed with you during your booking visit. If you have any questions, please feel free to ask your midwife or doctor. We look forward to seeing you.
Hello, my name is Samantha and I work with a team of dedicated midwives who form the Domino Midwifery team here in St Luke's General Hospital, Kilkenny. We as a team of midwives provide continuity of care for low-risk women who choose to avail of this service. Our ethos is to encourage, educate and support birth normality while caring for you and your baby during your pregnancy and your birth. We endeavour to do this by promoting normal physiological birth through shared decision making and informed choice. We really want to help empower you through your pregnancy and birth journey to facilitate a positive birth experience. We also enjoy meeting dads-to-be and birth partners also, and encourage them to attend the antenatal appointments with you. We provide routine antenatal care in our clinics, which are held every Wednesday in the Sacred Heart Hospital in Carlow and every Friday in the Antenatal Outpatients Department here in St Luke's Hospital. Women who choose our service continue to have shared care with their GPs. We aim to facilitate an early discharge home from hospital, and our team will continue to care for you in the postnatal period, providing support and advice in the comfort of your own home for up to 1 week following the birth of your baby. This postnatal service is available to anyone living in the area of Carlow and Kilkenny. We take direct bookings to the Domino service by email at community.midwifery@hsc.ie. Or you can ask your GP to send in a referral to us directly. Or when you attend your booking a clinic in the hospital, you can ask to be referred to our service. We wish you a happy and positive pregnancy and birth journey.
Hello, my name is Stephanie Hayes and I'm the perinatal mental health midwife based in the maternity unit at St Luke's General Hospital, Kilkenny. As part of my role, I provide care and support to women in the perinatal period who may be experiencing mild mental health concerns, have a strong fear of labour or childbirth, or have found that their birthing experience did not go as they planned or hoped for. For ladies who are already under the care of their GP or a community mental health team for moderate or severe mental health conditions, for these ladies, if additional or urgent support is needed, I can liaise with the psychiatric liaison team here at our hospital for their specialist input. When you come to visit me, you are given an opportunity and a safe space to discuss any concerns or worries that you may have in a confidential and comfortable environment. Together, we can formulate a plan of care for your perinatal journey, where your emotional health and needs are a priority, to help you feel as well as you can be throughout your pregnancy and postnatal journey.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body, where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high-fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now.
During your pregnancy, you will be offered a minimum of 2 scans. The first is in the antenatal clinic at your booking visit to date your pregnancy. And the second, the anomaly scan, is done here in Fetal Assessment St Luke's when you are between 20 and 23 weeks. This appointment will be made in the clinic before you leave your booking visit. The anomaly scan is a detailed scan which takes between 30 to 45 minutes depending on how the baby is lying and cooperating at the time of the appointment. The scan is not invasive and it's done transabdominally or through your tummy. We will be taking your baby's measurements, determining the location of the placenta and assessing the amniotic fluid. We will also examine the anatomical structure of your baby, including the head, face, chest, heart, bladder, kidneys and limbs. At this stage in pregnancy, it may not be easy for you to make out what you're seeing on the screen, but we will explain what you are looking at and we will welcome any questions that you or your partner have. You will also be provided with some written information to read about the scan before attending for your appointment. We recommend you to read this information and we look forward to seeing you.
Hello, my name is Shirley and I'm part of the Women's Health Physio Service here in St Luke's, which covers the maternity services. First of all, congratulations on your pregnancy. We wish you as healthy and active a journey as possible. So why is physiotherapy part of the maternity service? Muscles and movement are our bread and butter. We are here to help with any physical issues you may have during your pregnancy and beyond. In particular, during pregnancy, we focus on pelvic health. That is, anything to do with the pelvic floor muscles, the pelvic joints, the lower abdominals and the lower back muscles. It is normal to expect a few aches and pains during your pregnancy. What I would say is, we don't want pain that stops you from sleeping at night. The physiotherapy service here in St Luke's covers the antenatal education classes. We're part of that. I would encourage as many people as possible to attend these free classes. They are a super resource. During your hospital stay, we endeavour to see as many mums who have recently had a baby, giving them expert, evidence-based practical advice. In the postnatal period or the 4th trimester, we can follow up on any physical issues too in our specialised outpatient clinic. Some of these issues are related to bladder health and control of urine. I would say to most mums, at their 6-week check, following the birth of their baby, they should be able to cough, sneeze and laugh and be in control of their urine. If this is not the case, it may be that you just need to do a little bit more homework, but I would recommend that you let somebody know at one of your clinic appointments. There's always help available if you need it. Please ask for a referral to physiotherapy if you feel you do need it. Finally, as I said at the beginning, we wish you a healthy and an active pregnancy. The guidelines for exercise during pregnancy are 30 minutes of moderate exercise on most days of the week. Have a think. Are you achieving that? And always remember, movement is medicine.
Hi, my name is Susan Sherwood and I'm the Advanced Midwife Practitioner here in the Obstetric Assessment Unit in St Luke's in Kilkenny. The Assessment Unit is the emergency room / day ward for maternity services here at St Luke's. It's open from Monday to Friday 8 to 8 and out of these hours if you have any issues you'd attend the labour ward and be seen there. So the referral process is you can refer yourself in, the GP can refer you, the antenatal clinic, the fetal assessment or the early pregnancy unit. It's located up here in the maternity unit on the 2nd floor If you have any issues that arise during the pregnancy, you would refer to us here in the assessment unit. So we see patients with issues in pregnancy like decreased movements, vaginal bleeding at any gestation, blood pressure, pain, urinary tract infections. If you have a low iron level, you might come from an iron infusion, an anti-D, and among a lot of other things. So here when you come, you would be reviewed by myself or one of the obstetric team.
Hi, I'm Mary Phelan, one of the lactation consultants here in St Luke's Hospital. Together with my colleague Marie Woodcock, we provide specialist care and support around infant feeding. We are based on the maternity unit Monday to Friday from 9 to 5. Part of our role is to assist in preparing and supporting parents in the decision on how to feed their baby. Breastfeeding gives your baby the optimum start in life. It is species-specific milk, which is human milk for human babies and is ever-changing in composition throughout your breastfeeding journey. Your breast milk gives your baby so much protection and all the nutrients they need for the first 6 months. After 6 months and beyond 2 years of age, as recommended by the World Health Organization, your breast milk continues to be an important part of your baby's diet as well as other foods. There is lots to think about in pregnancy when you're preparing to breastfeed your baby. It is important to have gained an understanding of the expected norms of breastfeeding, especially in the early days and weeks. This, along with the right support, can help you and your baby on the right path to successful breastfeeding. You can obtain this information many ways while pregnant. At each of your antenatal visits, there is an opportunity to discuss any concerns or issues you may have around feeding. Our antenatal education programme includes a breastfeeding preparation workshop. You can register for free classes by email at slk.antenatal@hsc.ie. If there is an individual issue that you would like to discuss in relation to feeding your baby, you can ask your healthcare provider to refer to us here in St Luke's and we'll have a chat about your concerns one-to-one. Attending a peer support group in the community, such as La Lesh League or Quiz You, can be really beneficial while pregnant. Become familiar with the HSC website mychild.ie, which has evidence-based information and a live web chat with a lactation consultant. Read lots of information on breastfeeding on our website mychild.ie and in your My Pregnancy booklet. So congratulations on your pregnancy. I look forward to meeting you and your family soon.
name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created labour hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of labour hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The labour hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the labour hopscotch is called the mobilised square, and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced labour hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.